As children in our area prepare to head back to school, many parents are worried since young children can't get the COVID vaccine right now.
However, companies are in the middle of trials, and part of the Pfizer trial is taking place at Driscoll Children's Hospital in Corpus Christi.
And we're joined now by Dr. Jaime Fergie. He's the director of infectious diseases at Driscoll Children's Hospital. Thank you for joining us, Doctor. We really appreciate it.
It is my pleasure.
Now, yesterday I was on the clinicaltrials.gov site, and I noticed there are still hundreds of clinical trials underway right now addressing the COVID-19 pandemic. How many of those are children, just generally speaking?
Well, there are several. I don't know the exact number, but there are several from all the vaccines that we're currently have under emergency use authorization in the United States. They're also doing studies in the little kids. And that's what we're doing here in Corpus Christi at Driscoll Children's Hospital.
Can you give us a few of the particulars about the study? How many kids are in the study? What's the age range, and how long will this study take place?
So the one that we're doing here right now, and that we have received patients from San Antonio and Austin area, is the Pfizer vaccine. And we are doing the study for children between the ages of 6 months and 11 years of age. We have about 36 kids in the age group 5 to 11, and then we have about 50 more kids in the younger age group. And the study began in June. We're doing the one dose, follow second dose 3 weeks apart, and of course, it's a study. So some children get a placebo, and other children get the vaccine. At the end of the study, however, those who receive placebo will be given the vaccine.
Dr. Fergie, when do you think you're going to get your first release of initial results?
Well, I cannot tell that at this point yet, because the study has not been completed. So, we usually like to wait for several months after the end of the vaccination. So we are just, giving the second vaccine. Then we like to follow up for about 6 months. So the company, of course, Pfizer in this case, they will have to decide when they unblind, when they get information on the study, when to submit it. But, I am hopeful, and this is my personal opinion, I'm hopeful that before the end of the year, we may have a vaccine that go down to 6 months of age. Right now, as you know, the Pfizer vaccine in particular is is authorized beginning at 12 years of age.
Obviously, some schools here in San Antonio start next week. I'm sure that's the same for Corpus Christi. So what are you telling parents as we wait for the results of this Pfizer test? What are you telling parents as far as getting their kids back into school, especially when it comes to masks? There's such a controversy about should kids wear masks, should they not wear masks?
Well, the first thing I tell them, look, take advantage of what we have right now. And that is, we have vaccine for everybody 12 years of age and over. And those are the people who can really transmit it. The little children usually do not transmit it or don't do it very well. So let's protect everybody and the children who cannot yet receive vaccine by vaccinating 12 years of age and over. And that's a significant amount of people that needs to be vaccinated. And then insist on the teachers and all the adults in the schools to be vaccinated, because they're the one who can transmit the illness more towards the children. Children rarely transmit it to anybody. So it is important. First of all, as a pediatrician, I believe children need to go back to school in person. And second, I think that the school can be made safe by everybody that can be vaccinated to be vaccinated. Then the controversy about mask or no mask, I think that it is prudent to use a mask, because the mask particularly helpful in stopping the spread. So if somebody is infectious, they also know it, then you put the mask, you decrease the chance of that person spreading the virus to somebody else. But I tell you, that's great. But the most important thing, vaccination. Parents need to be vaccinated, teachers need to be vaccinated, and the children who are 12 years of age and over need to be vaccinated.
Down in Corpus Christi, have you guys been seeing any childhood cases of COVID as we have seen around the country?
Yes, we have. But the good news is this. We have seen a few. In general, the ones we see are mild symptoms. The one we have seen with more severe symptoms are usually adolescents, older adolescents with diabetes, with obesity and underlying conditions. But the number of cases that we are hospitalized are very few. I mean, it's a very different story with children from adults, as you know. But yes, we see some, and I think they reflect the increase in transmission that we've seen in community that is happening, unfortunately, because so many people have chosen not to vaccinate.
Back to your study real quick, Doctor. Have you seen any kind of information that has come out of this? I know it's still early, but has there been any information come out of this study so far that may be able to help parents decide on how to take care of their kids here in the near future? Any information at all in the study?
No, I really can't talk about any results on this study because I don't even have it. It's blinded to me as a principal investigator here in Corpus Christi. So I do not know who has received the vaccine and who has received the placebo. In general, I can tell you our patients, our children in the study are doing well. And by the way, I want to say we are very grateful to the children and the families who have decided to participate in this study because they're going to help everybody else. We need to have a vaccine for young children, and this is the only way to get it.
I appreciate so much that you said that, because without people signing on to take this chance and be a part of this clinical trial, we really wouldn't get to the bottom of the issue, which is, can we vaccinate children 6 months and older? And, you know, as well, many thanks to you and Driscoll Hospital and all of the other medical facilities that are using time and effort trying to help us get through this pandemic. This, we really are at your mercy, and we appreciate the thoughtfulness that you put into these clinical trials.
Well, and thank you both very much for reaching out. We are very happy to be able to do this for the community, and most of all, we're very grateful, as I said before, to the patients themselves and the families.
And we know, as you mentioned, there's some patients from here in San Antonio and some from Austin that are involved in the trial, so we appreciate them very much.
Yes. Thank you, Dr. Fergie. We really appreciate meeting you, and we can't wait to see the results of your clinical trial, hopefully by the end of the year, early next year.
We will have to have you back for the results of that.
Yes.
We'll talk about it then.
I'll be delighted. Thank you for having me today.
All right.